Welcome to Housing First on KAFM, a monthly conversation about housing in the Grand Valley with the organizations and advocates who are working to create a stronger path to safe and affordable housing in our community. I'm your host, Chris Masters from Homeward Bound of the Grand Valley. Today, our guest on Housing First is Roman Brawley, Community Engagement Architect at Ava Health. Roman, welcome.
Thanks for having me.
Thank you. You're the first guest of the new year, so let's jump into it. So what do you do what's going on at Ava Health? I know you're relatively new to the community, so let's just, hear a little bit about you and what you do and what your purpose is and why you decided to come to Grand Junction.
Yeah, I mean, that's a longer story.
Yeah.
However, Ava Health, substance abuse services, mental health services out here at Grand Junction, all levels of care. What do? Community engagement architect. I think I have to tell you legally I'm not actually an architect, but the premise of my job is to build relationships between program and community, provide information, education, and create collaboration. At least that's the hope, And Grand Junction, why here? Why not? It's come to our attention that the Western Slope has really been a desert for a lot of these treatment services for a long time. So it just made sense if we were going to do something that this was the place with the biggest need. And over the last year of talking to people in the community, it seems that that's the case.
Yeah. And you say treatment. What kind of treatment are we talking about here?
Yeah, everything from residential detox, medical detox, mental health, stabilization, outpatient services, transitional housing as well. So really the full spectrum of anything that anyone could need regarding substance abuse or mental health. That's what we do.
It sounds like a wonderful program you have. Why are these services so important in Mesa County, in this region, and what is the effect that these services have on individuals?
Yeah, well, I think it's no secret that substance abuse and mental health is a big problem, not only here, not in Colorado, but our country. And our owners about 2 years ago had talked to some people in Colorado about a need for services. And if you looked at the map, all the services that were available were on the Front Range, heavy emphasis on Denver, Boulder, Colorado Springs, and there was nothing out here. So really, it was the community that cried out for this to come to fruition. So we just happened to be the ones who were in the right place at the right time with the right vision to kind of bring it to light. But really, this was a community coming together and saying we need something, and that's why it's here. So as you're I think your opening date's going to be February 9th, if I'm not mistaken. Yep.
And that's when you're going live. Now, will all services roll out on that date?
No, we'll start with outpatient services, just the nature of what we're doing. We're going to roll out all inpatient residential services the following month. So we'll start with outpatient February 9th, and then in March we'll roll out all the detox and residential services.
Okay. So with your residential services, what type of program, how long is that program, and what does that kind of look like?
Yeah, so it's really dependent, on the individual's need. So we're working with, the competency docket, people who are currently incarcerated, who need services, who aren't receiving them. So they might need a place to come from jail just for a week, just to get, stabilized, and then they can move into outpatient services. And then we might have people who are currently in withdrawal protocol from, opiates, who might need to go through the detox and then the residential. So that might be like a 30-day stay at the residential. So really it's individualized. And what we're seeing a lot of is that people are so unique, especially out here in the Western Slope, for their needs. Mm-hmm. So it's really up to us and our team to identify what those needs are and get the people in the right place.
Well, it sounds like you're doing good work. Now, the name of the show is Housing First. So let's talk about how is addiction and how is mental health a barrier to an individual gaining housing? Yeah.
I mean, outside of finances, addiction and mental health, to me, would be the biggest barrier. My own experience with unhousing, people who are unhoused has always been some sort of, there's something going on other than just a lack of a place to live, you know? And there are programs out there that offer some services without that housing piece, and it just seems to be a giant crack in the concrete. So I think, especially when you're talking about incarcerated people who are coming out of jail, I mean, without any services, treatment for those behaviors that got them there in the first place, like the likelihood that they end up back in the streets is high. So they need to be addressed. And so it kind of goes hand in hand, you know, and it's like, what came first, the chicken or the egg, you know? Is it homelessness or is it substance abuse and mental health? Well, it's both, right, at the same time.
Right.
You know, so you have to address them both at the same time in order to truly, like, solve that problem.
Yeah. You mentioned a few questions ago, stabilization.
Yeah.
So when it comes to recovery, when it comes to mental health, when it comes to housing, quite frankly, why is the initial stabilization piece so important?
Yeah, that's a good question. You know, we've been talking and working with the Mesa County Sheriff's Department and their co-response team. And one of the things that they're seeing a lot is they're getting calls to go out to meet with an unhoused individual who's currently in crisis. You know, right now they have a deputy take that person to the ER. That's the only option.
Right.
And then they're at the ER for 8 to 10 hours. The deputy's staying there waiting for that person to be seen. And then at the end of that, either that person goes to jail or more likely back to the streets. Right? So that's a huge problem, right? That's a problem for the resources available of the time of the deputy who could be out doing other things that are involved in their job. And then also that unhoused person who's just getting recycled through the same old system. So our stabilization really is kind of a buffer for that. Hey, you got somebody that's currently in crisis you don't know what to do with because you're not trained specifically to deal with that. Let us do that, you know? And then if there's something else that's needed afterwards, cool. Like, we can collaborate on figuring that out together.
You know, from working in the shelter system, it's really apparent that when someone enters the door, the initial welcoming, the allowing someone to get rid of that fight, flight, or freeze so they can calm down and focus on their issues. I find that that's really important when it comes to this population.
Yeah.
And it sounds like, you're working on a plan to make sure that you can bring people in, you can get them stable, you can get them comfortable, and then you can work on those issues. I know that someone who suffered from being unhoused and addiction, I know that these services are extremely important. What is the volume that you're looking at serving? Do you have any idea what that's going to look like?
We'll see, right? Like, to be determined.
Right.
I know that we're going to be servicing the entire Western Slope and maybe other parts of Colorado as well. So the need's great, you know, and we'll do everything that we can to serve those who are in need. Yeah.
I mean, Grand Junction is a hub. I mean, we look at the shelter system and even kind of what you all are doing. We have 14 surrounding counties surrounding us in between Salt Lake and Denver. And it's a desert here for addiction recovery, for homeless shelters, for all of these things. So the work you're doing is so important. You are listening to Housing First on KAFM Community Radio. We're chatting with our guest, Roman Brawley from Ava Health today. So, Brawley, what are some of the partnerships that you've made as you're going through this in the community, as you're getting started up and whatnot? What are some of the partnerships you have?
Yeah, it's a unique experience. Our owners came out here about 2 years ago, a year before funded, and then spent the entire last year embedding into the community, right? We wanted to take an approach that's different than, like, let's market ourselves and get the billboard and do advertising. Really, the idea was, hey, let's meet the people in the community and figure out what the needs are and then build based on what the community says they are. So everything from the Sheriff's Department, Grand Junction PD, working with the jails, working with probation, parole, Colorado Department of Corrections, meeting everyone and saying, hey, like, tell us how we can help and let's bridge that gap. I mean, when we're talking about unhoused, when we're talking about substance abuse and talking about mental health, like, there's a giant gap. So for us, our ideal is to just be a bridge.
Yeah. All of those things go hand in hand.
Yeah.
I mean, we see it all the time. You have someone comes to the shelter. It's not just as simple as them being unhoused. There's a backstory there, whether it's whether it's mental health, whether it's addiction. And again, I keep saying it, but I just can't stress how important the services that you're providing are. As we start this new year, I'm really excited. It seems like we have a lot of partnerships, a lot of collaboration in the community going forward this year. And I just can't wait to see what you all do in the upcoming future.
Yes,
I believe in what you all are doing, and I just cannot wait to see it blossom and bloom, and just see all the individuals you serve and the impact that you make on this community. So, Roman, I just want to thank you for being with me today.
Of course. Thank you.
Of course. This has been Housing First, a monthly feature on KAFM's Community Affairs Hour. You can listen to past episodes of Housing First and other shows by subscribing to Conversations at KAFM, wherever you download your podcast. I'm your host, Chris Masters from Homeward Bound of the Grand Valley. Please join us every month for more informative topics regarding housing in the Grand Valley.